Increased numbers are travelling to countries like Turkey and South Africa to have weight loss and other cosmetic procedures done relatively cheaply. It allows them also to skip the waiting lists here, which can sometimes be up to 4 years. But they often face complications, and in those cases they come back to the NHS to get them to fix it for free. Doctors here are saying that they're being left to pick up the pieces, and that's putting an extra burden on them and the NHS. So should the NHS charge to fix these issues, or do you think that would be unfair? Wilfred, free at the point of need.
Look, I can understand people wanting to go abroad to get certain surgeries that shouldn't be done on the NHS. Take something cosmetic, it's definitely go and do that abroad. But one of the things that I really do have an issue with is if somebody goes abroad, have it done and it's botched, then we have to then repair the damage. I think it's wrong. But also the idea that people think that by having surgery for conditions like obesity is the right thing to do, I think is crazy. What I think obesity is, it's a psychological problem that has a physical manifestation. So rather than thinking surgery is going to fix the problem, you've got to try and understand what is it about you that you cannot stop eating, or you're not eating the right sort of stuff that's allowing you to put on weight.
But maybe you want to happen in tandem, and it has been proven to work very well, actually, these sorts of surgeries. It's just sometimes there can be complications, and in those cases...
I just think there should be a lot more emphasis trying to work out what is going on in your head that you can't just stop stuffing yourself with food. That's what it comes down to. It may seem a bit harsh.
No, when it comes to obesity and weight issues, I think it is incredibly complicated, and I mean we could do a whole debate on that, but in this instance I just want to focus on those people that have gone abroad to have this surgery done, maybe to skip the queue, maybe because the NHS won't let them have it, or they've got limited resources.
Well, the figures are interesting, Storm, because actually I think 5,000 people travelled abroad last year for bariatric, if I pronounce that right, surgery, but only 4,500 were treated on the NHS. And when you think that obesity costs the NHS or costs the country 6.5 billion every year, you kind of start to think, well, why aren't we putting more funding into paying for weight loss surgery in the NHS? Because it seems a bit ridiculous that more people are having to go abroad than having it here. And then, of course, when they do go abroad and things go wrong, the NHS is having to pick up the bill. I think the statistics are something like, for 35 patients, the interventions at 5 hospitals for 35 patients in 2022, when things went wrong, it cost the NHS a total of £560,000, or 16,000 per patient, almost as much, in fact more than it would have been to do the surgery here in the UK, because of course people have died. So I think it's very, very tricky, because of course, you know, and Anita Bevan said, you know, when he set up the NHS, it should be free at the point of delivery, regardless, you know, if you're pauper or billionaire, regardless of what happened, you should be able to get treatment free. I think it's very, very hard.
This surgery is basically to stop you eating, isn't it? It's to reduce your appetite.
Well, that's one of the surgeries that they go to Turkey for. You've also got dental surgeries, you've got surgeries for hair loss. People go to other countries for lots of cosmetic surgeries as well. So I don't want to completely get hung up on the gastric band procedures.
Anything that is cosmetic, it's your choice. And if it goes wrong, you should have some sort of insurance policy. What I would be advocating, fine, go abroad, but you have to have some insurance policy, so if it then goes wrong and the NHS has to fix it, they could claim from the insurance company.
What about, Emily, if we're talking about cosmetic surgeries then, should they have to pay?
I think they should, actually, yes. I think if it's something like that Brazilian bum lift, which can be very, very, they can have huge complications.
And they're fashionable.
It's really dangerous.
Yeah, it's really, really dangerous. Kids don't do it. Grandchildren don't do it.
But it's a fashion. They'll have these fashions that everybody decides they need to have this, and they'll be out of fashion in another 5 years' time or something. They're going to have it reversed then.
Yeah, and actually that's a really good point, Wilfred, because I think a lot of people who do go and have surgery abroad, cosmetic surgery and weight loss surgery, they document it on TikTok.
Yeah.
It's encouraging other younger people maybe to have it done as well, and sort of look at me on, you know, and it's the sort of the social media following, and I think that has a dimension that can be quite deleterious as well. So I think when it comes to cosmetic surgery, if you choose to go and do it abroad, then perhaps you should
have some insurance.
Pay for the consequences or have insurance. OK, let's now speak to Dr Anita Raja, GP in Birmingham. Dr Anita, should the NHS be charging to fix these botched jobs, and does it make a difference if it was for a weight loss procedure that perhaps that person did need, or a cosmetic procedure?
it's a very good question you've asked me. First of all, I was listening to your conversation a minute ago, and I would like to correct some facts that have been said. Weight gain and obesity is not just a psychological problem. We now know that there's a genetic predisposition to becoming overweight, and it is far more complex than just being greedy and wanting to eat all the time. We know that the NHS is drowning under the costs of obesity. Why? Because obesity causes 13 types of cancers. Cardiovascular risks go high when you're obese, and many other metabolic conditions. So it's very important that, first of all, we ask ourselves, why are people going to other countries for obesity surgeries or weight loss surgeries or to combat obesity? It's merely because within the NHS, the system is so long-winded and so difficult that people become desperate and go abroad to have weight loss surgery. Now, first of all, you must appreciate that these people who are going abroad are not millionaires. These are normal people with normal jobs who are actually saving up money, going abroad and taking the risk of seeing someone that they think is a doctor, is saying that they're a doctor, but there's no way for them to find out whether or not they're a doctor. They're putting their lives at risk. Can you imagine how desperate this patient must be to board a plane to go into unknown territory and put their lives at risk just to lose weight? I would say that any type of weight loss surgery on the NHS should be made more widely available for people who are morbidly obese, people who have a BMI of more than 35, for instance, 40, for instance, and they should make it easier for people to access care. The second thing I would like to say is that it depends on what a botched surgery is. Is the botched surgery an asymmetry and a breast implant that somebody has done to look better aesthetically abroad? If that is what you want to be fixed on the NHS, then I guess we'll have to think twice. But if you're telling me that someone has come back from some form of weight loss surgery, tummy tuck, they have infection, they have complications from that, then definitely the NHS must look after this patient, because at the end of the day, these are our patients. We have left them down, and this is why they have entered unknown territories abroad.
Okay, Dr. Anita, stay with us. We've got lots of calls coming in on this, so I want to get to them as soon as possible. Helen from Dorset, what's your view? Should these individuals have to pay to get their botched jobs fixed?
Yes.
Even if it was for weight loss surgery?
Yes. They chose to go abroad and have this done rather than have it done here.
I hear you, Helen.
Why should we pay for the botch-ups?
Well, why should the NHS fix somebody's broken arm when they went skiing? Because we know that's dangerous.
Yes, but I mean, that's different, isn't it?
Is it?
You probably got insurance for that.
If you go, well, I mean, if you had it abroad, but let's say you were up in Aviemore in Scotland and it was the NHS that was fixing it. What I'm saying, Helen, is it's a slippery slope, isn't it, when we start to make decisions about the lifestyles that people live and the decisions they make in their own lives and whether they are allowed to have treatment on the NHS. Smokers, for example, are you going to make them pay for their cancer treatments because they chose to smoke? Obese people, are we going to make them pay just because they chose to overeat? Rugby players, are they going to get treated for head injury? We all do things that are dangerous in life to some extent, and we expect to be treated on the NHS.
Yes, but that's different, isn't it? We're
I don't see how
going abroad to get the job done.
I don't know how it's different. It's making bad choices, potentially, Helen, you're absolutely right, or choices that are more risky that are leading to people suffering and needing help.
Well, I think it does.
Okay.
If they're going abroad to have their teeth done,
yes,
and goodness knows what else, it's ridiculous. And then we pay for what they've messed up when they come back.
True, Helen. Thank you very much for your call, and you're more than entitled to your view. Tim from Merseyside, what's your thoughts on this? It is a difficult one.
Oh, it is a difficult one, and in fact, actually, you've just covered really what I was going to say.
Oh, sorry.
Yeah, we can all make silly mistakes, can't we? And we can fall down a mountain skiing, or we can fall off a ladder painting our window frames, and we can all do silly things. We shouldn't have to be made to pay for them. When you make silly mistakes, we can all make silly mistakes.
I wonder, Tim, whether there is a compromise in here. I'm going to put this to Dr. Anita. the NHS knows that people are going off to these countries to have these procedures done because of the waiting list on the NHS, and maybe they don't want to wait, maybe it's cosmetic. Is there a way that the NHS might be able to go and visit these establishments and then put a certificate on certain places where they say, OK, if you're a Brit, we're willing to take on the botched jobs at these hospitals because actually we think they're very good hospitals and the risk is very low, rather than just letting it be the Wild West and people go out and they don't know who they're seeing?
I mean, the NHS definitely doesn't have the capacity or the bandwidth to be doing that. I mean, we know how long the waiting times are within the NHS. We're struggling. 2-week waits have become much longer than 2 weeks waits. We know how bad the A&E timings are. So I don't think that the NHS has the capacity to do that. But we certainly need to look into obesity as a whole in much more detail, I'd say, and not just say, yes, you're overweight and you're using words like fat because you're eating more. That is not the case. Some children suffer from childhood obesity, and that is purely because there is a genetic predisposition for that to happen. So I think we've got to be very clear here. I'm a GP and I see patients day in and day out who've had surgery abroad. For instance, I'll give you an example. I had a patient who had a very big breast. Now, these big breasts were giving her bad back pain and shoulder pain, and she was virtually crippled. Now, the NHS wouldn't do her surgery because her BMI is not 27. It needs to be under 27. And, lots of other conditions that they've put in place before they are going to touch this lady. Now, this lady did have to go abroad for surgery. She's come back. She's recovered well. And of course, we don't encourage that because we don't know who these people are who are doing the surgeries. As being in the UK, working here as a general practitioner, I'm proud to say that we're regulated. And we know about each and every surgeon that is touching our patients who are again regulated. If you're going to countries that are not regulated, you're taking that risk. We need to ask ourselves, why is the system allowing these people to go? If you're going for a Brazilian butt lift, that doesn't warrant any payment on the NHS. I mean, why should the taxpayer be paying for someone's Brazilian butt lift, I would say.
Yes, I understand, Dr. Anita, but people will be screaming at the TV, as I've seen Wilfred just try to jump in there. Why should the NHS have to pay for someone to have a bigger bottom? I get it. But then why should they have to pay when it goes wrong?
Wilfred,
you
don't have breasts.
No,
can I say, as a woman who's slightly largely endowed, Dr. Raja, and actually you were reminding me of my best friend. I'm a Brummie, she's a Brummie. My best friend, tiny little lady, size 8, huge breasts. It caused so much pain.
No, but the point I'm making,
back pain. This is you think breasts are cosmetic surgery, but actually
it's a moral judgment. If you say
it's not a moral judgment.
Everybody's shouting. I'm just going to let Wilfred... Sorry, Dr. Anita,
I would like to just say one thing here. Look, as a doctor working within the NHS, I'm proud to say that we own our patients. We take their ownership. We cannot leave a patient infected, septic to die just because they've been to Turkey for a Brazilian butt lift. That simply does not happen. This is comparable to skiing in France, having a fracture, and many, many patients just board a plane and come back to the UK because the bill abroad is too large.
Okay, but can I just say, look, we have to draw the line somewhere, because this is what the problem we have in the NHS is, that we can't do everything. And what you're advocating is that we do everything. We have to make difficult choices.
Yeah, but Dr. Anita, isn't she saying that we shouldn't have to pay for somebody's bum to get bigger?
No, part of the argument is that actually, she was saying, for example, with obesity, some of it is sort of genetic factors, okay? But as an individual, you need to take responsibility if you know you've got these genetic factors. Like me, for example, I've got vitiligo. If I go out in the sun and I do not wear a hat and I will get cancer. I have to take that responsibility rather than thinking that society should take that responsibility. We all need to take personal responsibility, and the state steps in when it can, rather than the state taking responsibility about what people should and shouldn't do.
I agree with what you're saying, but do you know how expensive it is to eat healthy food? Do you know how expensive it is to buy strawberries? Do you know how expensive it is to get organic vegetables?
I'm in the food industry. I'm in the food industry. It's not that expensive.
No, we need to support these patients. It's not that easy. Poverty and obesity are linked now.
Definitely.
Being obese is linked to low socioeconomic status. This tells us a lot about why people are obese. It's just easier to buy that chippy than have, a basket of fruits, for instance. So we've got to change the way the pricing of things, the rise in living crisis. We've got to change the way we approach these patients. So we've got to be more compassionate. We need to show empathy.
Okay, I'm going to go back to the calls now. Sarah from Hertfordshire, I don't think we've heard from you yet. What's your view when it comes to the NHS fixing these botched operations now? It isn't just weight loss. We are talking about things like a Brazilian butt lift, for example.
Yeah. No, they need to be charged. It's not just a silly mistake when you're going abroad.
But these aren't
and then
necessarily wealthy people. They've probably saved up and they're spending all the money they have on what they think is
impatient. I'm waiting for weight loss surgery myself via the NHS. I've been waiting for about 3 years, going through all the appropriate channels and everything, and you wait. And my last time I had a call with them, there's a backlog. They're absolutely backlogged with people that have gone away, come back, and need treatment afterwards. The NHS, after you have weight loss surgery, you're with them on the system for a year because you have to go in for blood tests and so much aftercare. These people aren't getting it, and they know they're not going to get it, but it's a quick fix, and then they come back to the UK, we'll fix your problem.
I completely understand your issue with this, that actually because of their impatience, it's making you have to wait longer, and that's part of the problem, Dr. Anita, isn't it?
100%. And we've got backlogs. We know COVID happened. We know that, we're lagging behind. There's years of austerity. The NHS is, at breaking point. Doctors have been saying that. Nurses have been saying that. People are now turning towards other occupations, professions, leaving the NHS as doctors, as nurses, because they simply don't find the working environment amenable. I mean, if we look at the amount of doctors who've left the NHS in 2022 alone, it was 1,000 doctors that went to Australia alone.
Yes,
I mean, it tells us a lot about the pressure.
We understand the issues
the
of the
NHS
waiting
is trying to do too much.
Wilfred, hold on. We understand the issues of the waiting list. I suppose the thing that Sarah's bringing up is actually that is compounded her issue. And I can totally understand your frustration, is compounded by the fact that people are skipping the waiting list, they're going abroad and they're coming back and they're getting priority because they have serious infections or they have life-threatening issues because of that surgery. Sarah, thank you for bringing that to our attention. We are going to have a quick break now, but stay with us because we'll be coming back to this debate in just a moment after. But now I just want to hear a few more calls about whether the NHS should pay to fix botched surgeries that have gone wrong abroad. Now, Anne from Rhondda Cannon Taff, you're on the phones now. What do you think?
I personally went to Turkey to have a breast reduction. I was suffering severe backache and personal problems. I applied 3 times to have the procedure done on the NHS and was turned down every time. Couldn't afford to go private in the UK, so I went to Turkey to have the procedure done for less than half the price. Luckily, I've had no problems, but if I had, then I think I would have been entitled to have had treatment done on the NHS. I've worked all my life, paid national insurance contributions, which goes towards NHS treatment, etc. And like the doctor was saying, I think there is a duty of care.
I totally appreciate your situation, Anne, but I have to play the devil's advocate here, so bear with me. What would you say to somebody who is on the waiting list for a breast reduction? It's going to take 4 years, and what you've done there is essentially skip the queue, because had there been complications, you would have been in front of that individual on the NHS.
Well, by going to Turkey to have it done, I'm actually alleviating the queue on the NHS.
And you absolutely have, because it went right, but had it gone wrong, you would have added to that waiting time for that individual.
Well, saying that, I would have been if I'd been on a waiting list to have it done here, then I would still have been waiting on that queue, so it would come slightly.
That person that wasn't as fortunate enough as you to be able to save up to pay for, I appreciate, half the cost in Turkey, is waiting. They are that person.
Sorry, say that again.
So the individual that isn't as fortunate as you to be able to save up to pay for the operation in Turkey is on the waiting list. They are waiting. So that the person that you're talking about is there. Had you had an issue, you would have made them wait longer.
Well, only if I'd had a serious issue, which would have been really affecting my health or life-threatening, I wouldn't have wanted to take the place of somebody who had been on the waiting list that long.
But I mean, you would have, because they would have seen you if there was an issue with the surgery. What would you say to somebody that thinks that you should, if there was a botched element to your surgery, which thank goodness there isn't, but if there was a botched element, thinks that you should have to pay the NHS?
Well, like I said, I think I paid into the NHS all my life, so I don't see why I should have to pay again.
Well, that's what I mean. That's how doctors feel, and the doctors would want to be able to help you as well, Anne. But it's very interesting to hear from somebody who has actually done that. Wilfred, what would you say to Anne then?
Look, we keep saying that the NHS has got serious problems. It has to start making tough decisions about what it can do and what it can't do. Mm-hmm. We can't go skating around thinking that we could do everything. We need to get very, very serious. I'm sick to death of people moaning about the NHS, but not making the big, tough decisions we have to make. Is that we could do this, and there's certain things that we cannot do. Until we do that, we're just going to be pretending we could fix everything, and we can't.
Anne, thank you very much for your call. Tom from Kent, what's your thoughts on it?
I personally think they should pay. My daughter wanted to be fit by 30. She lost 15 stone over 2.5 years. And then the problems of saggy skin came about. So nobody was going to help. It's your problem, it's not ours. They move hell or high water, you will not get any help. Mm-hmm. So she saved, we helped her. Her first operation was £11,000 with a brilliant surgeon, and that was the tummy and arms. Some 4 years later, she now has to get her legs done, which are all wobbly, and her boobs. She doesn't have boobs. There's nothing in them. Apparently, it's a female issue. So the fat from the legs are going up into the boobs. That's another £8,000 more than having inserts put in. So she's now paying $23,000 in August to have that done.
And that's done in this country?
Yes, it is.
And you feel like people should pay because they are going abroad and getting it half price?
Yes.
So if you want to have those sorts of surgeries, you should have to save. Dr. Anita, thank you very much for telling us your story, and congratulations to your daughter for losing that amount of weight. Not easy. But Dr. Anita, you can understand Tom's frustration, for example, and other people that are on the waiting list frustration when you say, look, we have to fix these botched jobs because that's our duty, when it means that they are really skipping the queue for these individuals.
I'd like you to look at the whole scenario from a very different angle. People do not go abroad to skip the queue, but they go abroad in the hope that they will get a satisfactory result from the surgery. When they come back with a complication, they don't want to really have that complication. The complication makes them very uncomfortable, it's very painful, could be life-threatening, could even cause death. So if they are in a life-threatening situation, as a doctor, we must prioritize them. And I certainly don't think that that is a way that they intend to skip the queue in any way. Yes, of course, when you lose weight, there are lots of other complications, side effects that happen with that. And one of the biggest effects is, just like mentioned, lots of saggy skin. And sometimes the skin can weigh many kilograms, a couple of stones even, and that skin needs to be removed for a better quality of life, because you're essentially carrying that extra weight. Again, the NHS wouldn't offer you that treatment. Yes, they would offer you weight loss surgery, but when you have saggy skin, they're not going to offer you that. People do not have, thousands and thousands of pounds to pay for it. I mean, we need to reach middle ground. And the middle ground really would be that if someone is acutely unwell, as a doctor, it is our duty, as the national health system, it is our duty to offer them care. Knowing in our hearts that these patients did not want to skip the queue. Nobody wants to get unwell after surgery. It's a very, very unpleasant feeling to have.
Okay, thank you very much, Dr. Anita Raja, for joining us for that conversation.